Hello everyone, this is your guy, Vino. Welcome back to Vinos Corners. Yay! And today we are in a nursing corner. And we are going to talk about the most common interview questions in the district health board. We are not going to talk about, tell me about yourself, where do you live, how old are you? That is very common. Those questions are very common and they will not ask you. There's no challenge for that questions. First, I wanted to advise everyone to don't forget to pray before coming to your interview. That will give you more confidence. Also, be humble and honest in answering the questions. Without further ado, let's start it. Intro, pasok! Government hospitals in the USA and in New Zealand are focusing on behavioral based and something that happened to you in the past or something you experienced during your nursing career. Or if you don't have any, something that happened to you during your nursing school years. These kinds of questions are questions that will really put you on the spot. So, if you are interested, please stay tuned. Question number 1. Tell me a situation wherein you had a conflict with a colleague or a family or a patient and how did you resolve it? The first thing when it comes to conflict is not to take it personally. Answer this question using experience that you had during your nursing career or during your college years. Always put into your example your intention to understand the person and to respect them. Remember to include that you don't focus on the person's personality or behavior, but you focused on the solution to resolve the problem. What did you do to make it right? Listening to your colleague is the key. When you listen to your colleague, they will realize and give a time to listen to you as well until both of you come up with a solution. As I mentioned earlier, it should be a situation or something that happened to you in the past. That is really important because the questions are situational or behavioral questions. Example are based in a reflection of what happened to you. Remember my mnemonics. Come. C for compose yourself. A, ask what seems to be the problem in a polite way. L, listen to your colleague. Listening is the key to solve issues. M, move on. When I say move on, moving on not by turning your back or brushing it off, but finding a solution to be able to move on. And once move on, guys, forget. Parang pag-ibig lang yan, move on din pag may time. To those who haven't subscribed yet to my channel, please click the subscribe button. There. There. Click that subscribe button to be updated on my latest videos. Okay? Let's go to question number 2. How do you manage stress at work? I think I'm always stressed at work. For me to be able to manage stress at work is not to work. No. What I'm trying to say is stress in nursing is inevitable. It's everywhere. Whatever job you're doing, it still can be stressful. It will just depend on you. Always remember, guys, that stress in nursing is inevitable. Wherever you are, even in Australia, New York, Canada, Michigan, Chicago, United Kingdom, New Zealand, Mars, Saudi Arabia, or everywhere, it's the same level of stress. Hand washing steps never change, and managing stress at workplace plays a vital role in your nursing career, and of course the key to your survival. This question is one of the most common questions in the district health board questions. The reason they ask you this question is the role you're applying for involve ability to work under pressure and your attitude towards stress and pressure. Do not answer this question, I handle it well and I don't mind working under pressure. That's rubbish. They will not buy that. Talk about how you understand stress and pressure is a part of your role as a nurse. Acknowledge and relish the opportunity to show them your skills. If you were asked on how you manage stress at work, give examples. One example is how you organize your time, like making an organizer. What you have to do in the morning, 8 o'clock in the morning. Do you have to give medications? Do you have to do the vital signs or observations? Things like that. 8 o'clock, 9 o'clock, 10 o'clock. Just make an organizer. And so on and so forth. If you were asked what you do on your days off to relax and de-stress, one of the example is I actually handle stress in a couple of ways, like exercising on my days off, going to church, reading books, things like that. Just be honest and be humble. Try not to fabricate stories, because if it's not realistic, it's just gonna make you feel uncomfortable and gonna make yourself a little bit harder to answer the questions. Question number 3. What are the rights of the patients, and give examples on how you handle or applied it. The rights of the patients are the right to be treated with respect, right to obtain medical records, right for privacy of your medical records, right to make treatment choice, right to inform consent, right to refuse, right for to make decision on their end life, and others, a lot more. So don't get confused. And also remember, there's a follow-up questions that give examples on how you applied it. So for example, right to refuse the treatment. So give an example that happened to you in the past. Of course, it's so common that it happened to you in the past. Patients refuse to be treated. This is very tricky because there are also 10 rights for drug administration. Right drug, right patient, right dose, right route, right time and frequency, history, assessment, right drug approach, and right to refuse. So don't be confused. Question number 4. Can you give a situation wherein you have been successful because of your teamwork? On this question, I advise not to focus too much on yourself. Focus on the example and how the group worked together as a whole. Is there an incident that you were buddied with another nurse and you guys work together and overcome obstacle for both of you to be able to accomplish or achieve the success? So narrate it. Give example that express confidence and positivity. You want to convey that you do work well with your colleague or with others and that you enjoy it. For example, in my last position, I was a part of the hand washing audit team. We all worked together to improve our hand washing technique, and I have to observe and mark the other nurses discreetly, things like that. Just narrate. Tell them your experience and make sure you answer it in a behavioral base by giving examples. Question number 5. Give a situation wherein you maintain your professional boundaries with patients or residents. When we say residents, for those of you who are working in nursing homes, we call the patients as residents. Always remember that nurses top national polls of the most respected and trusted person. Example of behavior that crosses the boundaries between nurse to patient is discussing intimate or personal issues with a patient. Emotions are personal and a normal part of who we are, but we always remember that you as a nurse in the hospital, you are there to work and not to make friends. Cite an example that the patient kind of invade a little bit of your privacy and how you handle it. Like patient asks your Facebook account, refuse and say you are adhering to the hospital policy, but of course say it in a very, very nice way. Do not perform additional favors for clients outside of the scope of your role as a nurse. Those are the 5 DHB questions that will put you on the spot. I hope you guys learned something on this video. Don't forget to like, comment, and subscribe on my channel to be updated on the nursing corner of my life. Bye guys!